Yes, and some of you may have heard about Pharmacy First, which is a great scheme now in pharmacies where rather than going to your GP and seeing them in general practice, you can actually come to your pharmacy. So there are conditions such as otitis media, which are sort of ear infections that you'll often get as at a younger age, which your pharmacist can see you for and treat you for, and antibiotics sometimes are required for that condition. We can always also see for skin infections, or what we know as impetigo, where occasionally antibiotics are needed to help manage that. Infected insect bites are also something that we will see, particularly obviously more in the summer, and that can be something that can be managed in pharmacy with the Pharmacy First scheme. Shingles is another condition that we can manage. Shingles, which comes in the form of a rash, and sometimes you need to go on antiviral treatment for that, and that can be seen in the pharmacy. Sinusitis is another condition that you can see through Pharmacy First, which is something which commonly we'll obviously see a lot more potentially in the winter months. And again, for that type of condition, antibiotics are sometimes required. And sore throats is something that we can manage through in Pharmacy First via the pharmacists. And again, with those sort of conditions, you'll be seen clinically. And if it's appropriate, sometimes antibiotics are needed for that type of condition to help manage it better. And another condition that we'll also see in Pharmacy First are urinary tract infections. So any uncomplicated urinary tract infection can be managed for women in Pharmacy First. So yeah, please come and visit us in the pharmacies rather than accessing general practice for these conditions.